Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for today. I want to acknowledge that we're on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations, and we're honored to be here. Tomorrow, Friday, at 3 o'clock, we'll be providing a written briefing with case counts and other relevant information to the COVID-19 pandemic in British Columbia. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So for today, September 17th, we have a new high of 165 people who have been diagnosed with COVID-19 here in British Columbia, including 2 who were epidemiologically linked. And that brings our total number of cases to 7,663 in British Columbia. That includes 2,714 people in Vancouver Coastal Health, 3,937 in Fraser Health, 196 people on Vancouver Island Health, 489 people in Interior Health, 241 in the Northern Health Region, and 86 people who normally reside outside of Canada. We now have 1,705 active cases in British Columbia in all health authorities, of whom 57 are now in hospital, 22 of whom are in critical care or ICU. We unfortunately have 1 additional death to report today, one of our seniors in long-term care in Vancouver Coastal, bringing our total number of people who've died from COVID-19 to 220. And our condolences go to the family of this person, to his care providers, and to his community, and we mourn his loss. There are now 2,949 people under active public health monitoring and 5,719 who have recovered from COVID-19. We have 2 new healthcare-related outbreaks, both of them in acute care units, one at the Delta Hospital and the other at the rehab unit at the Peace Arch Hospital in Fraser Health. That brings our total number of active outbreaks now to 15 in the healthcare sector. With 802 active cases, 478 residents, and 324 staff. We have no new community outbreaks to report, but we do continue to have exposure events. And I would like to remind families and parents that for any potential case in our school, any exposure events in our school, public health teams will be contacting you. If you need to, we'll contact the public as part of our contact tracing if and when self-isolation or monitoring is required. Schools will also continue to post information on school exposures if there's any cases in schools. And supporting these protocols, the BC CDC website and health authorities are now publishing, as we indicated yesterday, school notifications. We have no outbreaks in our schools anywhere in BC at this point. We have had, and not unexpectedly, some staff and some students who have had been in a school setting during a time where they may have been infectious to others. None of these have been high-risk exposures, and everybody has been notified who needs to monitor for symptoms. On a positive note as well, we have some exciting new testing that we're able to provide for students in British Columbia. Containing the spread of the virus in our communities is, of course, core to our COVID-19 response, and that's why getting tested as soon as anybody has any symptoms is incredibly important. While we all do our part, supporting all of us has also been our research and scientific community, and we have been incredibly proud of the work that has been done by our research and scientific community here across British Columbia. And at the BC CDC and with our post-secondary institutions and the private sector, they have been supporting our BC response from the very beginning. Taking the step to get tested is how you protect your friends, your family, and your community. And now for K-12 students, we have an easier alternative than the nasopharyngeal swab that has been the standard that we've been using. Today, a new Made in BC sample collection program has been launched for all K-12 students across the province, and it is one of the first of its kind around the world. For school-aged children in BC, so those aged 4 to 19, a mouth rinse gargle is now available at the COVID-19 collection centres or assessment centres around BC, so across the province. So unlike the nasal pharyngeal swab, this is a new saline gargle where you put a little bit of normal saline, so the sterile water in your mouth, you swish it around a little bit and you spit it into a little tube. And that's an easier way to collect it for young people. And you don't need to have it done by a healthcare provider. This is something that you can do with the help of your parents if needed, or by yourself. So not only is this new method more comfortable, particularly for our younger children, it's a BC company that's going to be providing the collection tubes. And that this reduces our dependency as a province on the global supply chain, which we know has been one of the challenges, particularly around our lab testing. So we're quite excited about this news, and a huge congratulations and thank you to our scientists across BC and at the BC CDC. This is a really important thing for making testing accessible for our children and supporting keeping them in the all-important school environment. So we know now that living with COVID-19 requires all of us to consider that we need some give and take. We need to compromise. I can appreciate as much as anyone how difficult this can be. But it is essential for the well-being of all of our communities, and it recognizes the fact that we are going to be living with this virus in our communities for some time. It is not either or. We must continue for our community well-being, both the economy and our health. The BC Restart Plan is the focus of public health, and many, many people supporting these efforts. And it is to have as much as possible opening and functioning safely in our communities. And we know that we've had essential services going through this entire period of time, whether it's in healthcare, our food system, our grocery stores, our pharmacies. There are many different essential services, and we've adapted. We know that how important it is to have workplaces, grocery stores, restaurants, and schools open for the well-being of our community. And on the other side of the equation, we need restrictions, and at times closures are in place to limit the exposures to known higher risk activities and locations. And we have had to modify those over the last few weeks as we've seen cases increase. This give and take is not easy, but it is what will keep us safe and functioning in the months and weeks ahead. And I have said it many times, it is not forever, but it is what we need to do together now. And this is going to be our most challenging year. But as we work together, we build that resilience together, and that's what will keep us safe and help us through this and help us bounce back. One of the things that is really important at this point of time is the restrictions that we have on gatherings. And we have maintained a constant, consistent approach of no more than 50 people. This is another protective layer to contain the spread. It means reduced numbers of people, that when somebody inadvertently brings the virus into your collection of people, that group, it can't spread too widely. But we are seeing it spread, even in smaller groups, and we all need to take a step back and reassess. It's very important to remember that 50 people is an upper limit, and only where you have the space to do that to maintain safe distances. It needs to be scaled down based on the space that you are in. And I need everybody to understand that now. Whether it's inside or outside, maintaining safe distances is important. Keeping your numbers small is important. Just because you can fit 50 people into your small back garden does not make it safe. And that's where we're seeing transmission, and we're seeing transmission to people we care about, and now we're seeing spillover into people like grandparents, like elders, who are more susceptible to having severe illness from COVID-19. We are in a global pandemic, and these are the sacrifices we need to make. As we have seen, many businesses are only able to safely accommodate a few people. And the same applies for our homes, inside and outside. Regardless of our location, when we're socializing with others, smaller is always safer. The compromises we have made to keep ourselves, our loved ones, our communities safe means seeing fewer friends and family members, for now. The compromises, our small groups also need to be the same small groups. Spending time with different friends on different days significantly increases our personal risk. It means that we are now exposed to many more potential chains of transmission, and it's a continued source of transmission that we are seeing in our communities now. So when planning our activities, whether it's a play date for your kids, a weekend dinner party, a group of friends getting together, ask yourself if the people are part of your safe six, your group of people. Our grandparents, our aunties, our workplaces, our communities depend on this. Social connection, we all know, is essential. We are social creatures. We need that connection in our life for our mental and our emotional well-being. But now is the time to stick with six, to keep our groups small and only spend time with the people we know, with our safe six. The restrictions and precautions that we have put in place here are not forever, but they are needed right now. By stepping back now, we can protect those who are most vulnerable and keep the people we care about safe. And we can keep going with the workplaces. We can keep going with our surgical restart. We can keep going with the all-important education that our children need in school. So this month, let's remember, we need to get ready for respiratory season. We need to hold steady with our layers of protection and step back from our socializing with different groups. And that way, we can step forward with the routines that will keep our communities and our loved ones safe. And of course, we must remember, more than ever, as we get frustrated, as we get tired, as we get into respiratory season, we need to remember to be kind, remember to be calm. We will get through this storm, and remember to be safe.
Thank you very much, Dr. Henry, and on behalf of the Premier, and I know the government and the people of BC, I want to extend my condolences to the family of the person who passed away in Vancouver Coastal Health in the past 24 hours from COVID-19 in long-term care. This is, in particular, a difficult time for everybody dealing with COVID-19, but particularly those who lose a loved one. It's impossible to the same extent as we ordinarily do to have celebrations of life in the same way. And so that makes the grieving process all the more difficult. And we want to say to those who've passed away, that to the person yesterday, the 220 families who've lost people during this COVID-19 pandemic, to pass on our condolences and to hear their grief, understand their grief, and be with their grief. I wanted to note we had 165 cases, as Dr. Henry has said, overnight, and we currently have 57 people in acute care hospitals, 23 in Fraser Health, 1 in Island Health, 7 in the Northern Health Authority, and 26 in Vancouver Coastal Health. I know that this is down 3 from yesterday. We have 22 in critical care. And so obviously that's important work for people in our acute care system. In addition, people in public health have been doing an extraordinary job and an extraordinary effort. Just to put this in context, yesterday, 7,674 tests, which is the highest that we have done in British Columbia since the beginning of the pandemic. 2,949 people who are contacts, who are under public health surveillance, who are in self-isolation, and 1,705 active cases. And I add to that 3,641 responses to 811 calls, which is a significant number as well. Everyone in public health is working very hard, working with people who are dealing with COVID-19 in British Columbia directly, in supporting them and helping them to get well. And I want to acknowledge their extraordinary work. As this being Thursday, I also want to provide the weekly update on our surgical renewal commitment. the number of patients contacted about their surgery has increased to 90,897. Between May 18th and September 13th, we completed 102,598 surgeries. 78,437 of those were scheduled surgeries. 24,161 were unscheduled or emergency surgeries. That's 19,220 in interior health, 28,491 in Fraser Health, 23,829 in Vancouver Coastal Health, 20,848 in Vancouver Island Health, 5,941 in Northern Health, and 4,269 in the Provincial Health Services Authority. Last week, we reported 5,868 surgeries completed from August 31st to September 6th. Health authorities have verified their data, and the total number of surgeries completed was actually 6,085. This past week that included Labor Day in the count, we completed 5,503 surgeries, which is a significant amount, more than comparable to last year at this time. A key surgical renewal commitment is to add capacity by extending daily hours of operation, adding Saturdays and Sundays to the schedule, and opening new operating rooms where available. This week, Vancouver General Hospital opened 2 new operating rooms. Already on Vancouver Island, from Campbell River to the Saanich Peninsula, surgical days are being expanded and added in hospitals, including Campbell River, Comox Valley, Cowichan District, Royal Jubilee, and Saanich Peninsula hospitals. Since September 28th, starting September 28th, I should say, Royal Columbian Hospital will extend hours in 4 operating rooms, gaining 6.5 hours per day in each OR. Private contracts have been expanded across all regional health authorities in accordance with the Canada Health Act. The health authorities have taken tremendous steps throughout the summer to add surgical capacity. The results have been reflected in our weekly updates, where we've marked progress showing that we've caught up to pre-COVID-19 surgery levels and beyond, and then we surpassed them. Health authorities are continuing to add capacity and will do so throughout the fall and into the spring. From June 15th of this year to March 31st of next year, surgical capacity will increase by 16%. Moreover, this will increase by 24% in the year following. We said we would catch up to surgeries lost to COVID-19 within 15 to 22 months when we announced the surgical plan, the Premier did in May. We're on track to do exactly that. All health authorities are projected to be caught up on surgeries lost to COVID-19 by the end of next year, as well as doing all the surgeries that come forward. Vancouver Island Health will be caught up by February 2021. Interior Health by May, Northern Health by June 2021, Vancouver Coastal and Provincial Health Services Authority by August, and Fraser Health by December 2021. As we wrote on the surgical renewal commitment on page 11, many factors will help shape our success, including the potential for a second wave or surge in COVID-19 in the fall and winter. With that and the other listed factors in mind, we will adjust our target timelines if circumstances require it. I want to thank everyone involved in this extraordinary work by our public health care system, and it truly is extraordinary in the past months and in the coming months to increase and improve services to people for surgery in a time of pandemic. I also wanted to report on our contact tracing recruitment initiative, as we did last week. Just to note that to date, as you know, the Premier announced 608, what are now 608 contact tracing positions. To date, 153 people have been hired, and a further 137 are currently in the interview stage, with a further 24 in the offer process. We've had 718 individuals who meet the qualifications referred to regional health authorities and the Provincial Health Services Authority as required. So we are making extraordinary progress in hiring the contact tracers as announced by the Premier. In addition, and finally, the Healthcare Access Program that was announced last Wednesday as part of the Premier's announcement of the health sector plan for the fall-winter management of COVID-19. We announced a major recruitment and training strategy to bring from 5,000 to 7,000 new healthcare aides, cleaning and food service staff into the long-term care sector to add additional capacity. The response to the announcement has been extraordinary. In just 1 week, to the end of yesterday, 5,656 individuals have completed an online expression of interest. The intake will continue, and the expressions of interest will be reviewed and screened against the program's required qualifications. The process is in full swing. As we're at Thursday, and this is our last briefing for this week, we're reminded yet again of cause and effect. how wildfires along the U.S. coast unexpectedly caused significant health outcomes here and forced us to quickly learn and adapt. Indications are that in a few days, the smoke will clear. And when it does, let's see COVID-19 more clearly for what it is, a complex virus for its impact on our health and our lives. But when we've learned, we can push back by taking what are, I think we might agree, just a few basic steps to keep us all safe. Stick to physical distancing. Stick with regular hand washing. Stick to staying home if we're not feeling well. Stick with wearing a mask when it's the right thing to do. Stick to 6. Make 6 the maximum number of people we socialize with outside our household bubble, our safe 6. And stick with the guidance Dr. Henry provides us to bend the curve, not the rules. So this weekend, and as we plan for Thanksgiving and the fall months ahead, let's again close ranks on COVID-19 and change its course. Through what we've learned about the virus and ourselves and how we've adapted, let's stick together in our effort. Let's stick with what works, and let's stick with it to stop the spread. Aujourd'hui, nous annonçons 165 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 7 663 cas en Colombie-Britannique. Il y a eu un nouveau décès lié au COVID-19 pour un total de 220 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Chaque régie de santé de la Colombie-Britannique compte des patients atteints de COVID-19, bien entendu. 2714 se trouvent à Vancouver Coastal, 3937 à Fraser, 196 sur l'île de Vancouver, 489 dans l'intérieur et 241 au nord. Il y a aussi 86 cas de personnes qui vivent en dehors du Canada. Parmi l'ensemble des cas confirmés de COVID-19, 67 personnes sont actuellement hospitalisées, dont 22 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. And as a reminder to the media, please press *1 to line up for questions if you haven't already done so. We will be taking one question and one follow-up this afternoon. Also, please do not mute your phones. You will not be audible until I call your name. We begin today with Srushti Gangdev, CKNW. Srushti, go ahead, please.
Hi, thank you for taking my question. Pretty much every day that you've had a briefing in the past month, probably you've said keep your social interactions low, stick to 6 people. Within my peer group, I see people not following those rules, and some people are doing it on purpose, and some people maybe just aren't understanding where that distinction lies. Do you think that the 6 to 6 thing is a little ambiguous for some demographics right now, and why do you think that message isn't getting across?
I think you said it yourself. Some people are frustrated and they feel that they have suffered a lot through this. And I particularly feel for young people, you know, the young people who graduated this year from high school and missed out on all of those important social interactions, and who are going to universities that are mostly remote. You know, it's a very challenging time. And I think some of what we're seeing is a reflection of that. I think some of it as well is what you say also, that people aren't realizing that if you have a different group of people every night, then you're exposing yourself to an exponential increased number of potential contacts, because every person you're exposed to is you're being exposed to their risk that they bring with them from where they have been before. So it's a challenging concept, I know, but what we have to realize is this is how we're seeing spread happen now. We were seeing it certainly in some large events and large people having parties inside and outside where they were defying the rules, and we're just still seeing some of that. But, you know, we all need to do the right thing and try and influence our friends, our peers, to make sure that they do take this seriously. We're seeing now spill over into hospitals. We're seeing where our elders, our grandparents, our seniors, the people in our life who are most susceptible to ending up in hospital or dying from this virus are getting it. And sometimes they're getting it because we are not being careful enough as young people, and we're bringing it home unintentionally and spreading it to those we love. So we have to make it real for all of us. We all have people in our life that are susceptible. We may not realize it. Not everybody not everybody you can tell how old they are, and not everybody you understand what their own immune system may be doing. So the more people get sick, the more chances are we're going to have people infected who are going to get really sick from this. And we have seen that around the world. We're not alone in what we're seeing right now. It's happening in France, it's happening in Spain. We know it's happening in the United States, and we've been watching that very carefully. We all need to do our bit. We can do it here, and we can get through this. And we've had a summer where we've had the opportunities to do some travel, to do some social interaction. But as we move into respiratory season, as we do the necessary things to get children back into schools, to get our workplaces moving again and working again, we have to pull back on that social side.
And just to say that one of the very encouraging things we've seen in the last number of weeks is a number of young people who are part of our influencer efforts. So it's not just the Minister of Health, the provincial health officer, medical health officers, the system, the government delivering these messages, but young people speaking to young people. We can all influence one another, and I really encourage people to be part of this. So it's not going to be one slogan or statement or phrase, stick to 6, that will has all the answers for everybody. But we all have to, in our own ways, in our own voice, deliver these messages. Today, I reported on this extraordinary success that we're having in delivering surgeries in our public healthcare system. And that's people delivering above and beyond what they would normally do in a pandemic. And they need all of our support. I think it's an inspiring story for everybody. And so what we need is for everyone to be an influencer, everyone to speak to it. And if stick to 6 doesn't work for you, there are lots of other things you can say in addition to that, and that people can say in their own discussion, in their own voices, that can assist in this cause. We can all be leaders in this in the COVID-19 pandemic, and I encourage everyone to do that.
Thank you. Do you have a follow-up, Srushti?
Yes, Ontario has taken the next step to kind of bring back some of those restrictions on gatherings, and I think they've reduced them to 25 for outdoor gatherings. Going forward, if numbers don't go down, are you looking at imposing stricter restrictions?
Yeah. The short answer is no. We've tried to pick a reasonable number and to give people advice about what that actually means. And we have closed down places where it's not possible for them to be viable without people breaking the rules. So we are sticking with our numbers, but we also are, as we just talked about, appealing to people to make it fit. It doesn't mean that 50 is okay. If you're in a small place, it may mean that 6 is okay, or 2, or having a small number of people over. If it's outside, but you still need to maintain those safe distances, because what we're seeing is when you have lots of people together, inside or outside, and when they're close together and talking together and dancing or kissing or sharing food, we see this virus take a hold. And it can spread very quickly in those settings. So, people were concerned, where are we seeing transmission? And that's what we're seeing now. The places that we can modify, most importantly, are those social interactions where we're speaking loudly, where we're having close conversations, especially if they're indoors. And that's where this virus can spread really quickly.
The next question is from Hina Alam, Canadian Press.
Hi, Dr. Henry. I was just wondering if you could tell us a little more about this test. Is it going to be self-administered? And also, is this because you want to get more children tested, or is it because the swab test is particularly difficult for children, or a mixture of both? And how do you rate the mental health of children right now?
Two very good questions. So this test is it's kind of cool. It's been something we've had in the works for a while, and it is a way that we've tried to make it more efficient so that we don't have as long lineups and that it doesn't take as long to do. But we've had limited supplies. So to start with, we focused on children because we know right now it's going to be very critical for children if they start showing symptoms of COVID-19 and they're in a school setting, many of them will need to get tested. So it's a way to try and facilitate that and make that easier right now. And yes, it can be done. It needs to be done at an assessment center, but it's done by the parent or the child themselves rather than a healthcare worker. So it's a combination of wanting to test more children, knowing that more children are going to need to be tested now that we're back in the school setting, and making it easier. Ideally, and this is our plan as we're ramping up our testing, is making this type of a saliva test or a gargle test. It's just a different way of collecting it that makes it easier without having needing a healthcare worker. We want to have it available for everybody. Right now, the focus is on children for the reasons of supply. In terms of children's mental health, these are challenging times, and we have been working, as I've talked about a number of times, looking at the unintended consequences of the effects of the measures that we've put in place. And we know, for one, that suspension of in-class school is very dramatically affects the mental health of children and their well-being. We know that there have been challenges around substance use, around violence, around interfamily violence that we know goes up when schools are not in session. So it is incredibly important, and we as a community and as a province need to prioritize those school settings for our children for that reason. We do have some information both from the survey that we did and from data that we've collected that shows that the mental health supports for many children have decreased, and it's not spread evenly. Some of that information I presented a few weeks ago, and it is available on the BC CDC website. We know there's been challenges, and the one challenge I will bring up where the stats are still at the top of mind is across the board. Parents said about 80% of parents said that their children struggled with the online learning with classes being closed. So that's across all strata, all different race and ethnic groups, and all socioeconomic groups as well.
Do you have a follow-up, Hina?
I do. Thank you. And this is going on a slight bit of a tangent, Dr. Henry. With a lot of stores and coffee shops closing their restrooms, we are seeing more and more alleyways being used as toilets. Are you concerned that this might give rise to any other kinds of diseases, and what are you doing about that? Thank you for this.
That's not something that I had heard a lot of recently. Certainly early on there was concerns that there was lack of access to facilities, particularly for people who are living on the street or are underhoused. I know communities across the province are looking at how they can address that, and it really is an issue that is being addressed at the municipal level and regional level. So I don't have any specific information about that in the last few weeks. But I do know that the City of Vancouver, Victoria, other places have been looking at how they can support access to washroom facilities for people who need it.
Thank you. The next question comes from Tina Lovegreen, CBC.
Thank you so much. Dr. Henry, the group that represents bars and restaurants are asking to amend the public health order to allow liquor sales in the restaurants and bars until midnight instead of 10 p.m. They say those 2 hours are just, they make up a huge chunk of their revenue, and it will be the difference between some of those shops surviving or going bankrupt. And so now they're asking for those hours to be extended, and they're also asking for better consultation.
Okay. Yes, I received a letter from them, I think yesterday, with some of their concerns. And, let's be very clear here. We do not make these decisions lightly. We have been working with the Restaurant Association, we've been working with bars, we've been working with industry from the very beginning, and we put in the restrictions when it became clear that there was challenges meeting the safety requirements, and so we tried to be as specific as possible and as supportive as possible as we can. So it was clear from my colleagues, from the environmental health officers who are doing inspections, from the issues that we were seeing in communities around the province, that there becomes a time at the night when things become liquor forward, and we knew that there was ongoing issues with transmission, and it was becoming unsafe. It was unsafe. We had transmission events documented in several places around the province, and it was becoming increasingly challenging for public health to try and identify and get on top of those places who were breaking the rules. We were also hearing from WorkSafe and from employees in many of these restaurants and bars where things became out of hand later at night, that they felt that they were at risk. So we took measures that we felt were reasonable. We know that restaurants, most of them close by 10 or 11 o'clock. Most of them have perfect safety. They have very good safety plans in place, and they are working. But it is the late night when they turned into a lounge-type environment where they were having challenges. So we have consulted with industry. We've consulted with my colleagues who are trying to maintain our contact tracing and ensure that that places are able to maintain the safety measures, and we were still seeing transmission. So these orders were done with thought and with the realization that these were places right now that cannot safely operate. And we're not alone in this. It's not like we've made this up. If we look in countries who are dealing with this everywhere else, very similar restrictions are in place. We're looking at Ontario, Quebec, Alberta. You know, the fact that some of these nightclubs were open in the first place was a challenge. And they were, it has to do with the way the liquor license laws are here in BC. So, I appreciate that this is a very challenging time for people in that industry. I also know that this virus is transmitted by people, and it's those environments where we're close to others, indoors, where we're doing things without masks on, that are most risky. And this is the challenge that we face. So, I think there needs to be things in place to support those restaurants, those bars, and nightclubs and banquet halls that are affected by this. But these are the things that we need to do now so that we can get our communities through this next few months, maybe years.
Follow-up, Tina?
Yes, thank you very much. I just wanted to clarify another point that they made. They were hoping for better guidance on the orders, saying it's been more than a week since the verbal orders were issued, but they've not seen a written version yet, so they're having some issue figuring out what actually is allowed. So wondering when the written orders will be available, and if we could also please get a response in French.
Sure, yeah. The written orders, the legalese that goes into the orders come into effect when they are given verbally, and we have answered many questions from the field who have sent it in to myself, so I know that most of the questions have been answered and the details are there, but they need to be put through the legal phrasing to make sure that we are being as minimal as possible to address the issues that were concerns, and I'm hopeful they'll be up by tomorrow at the latest.
Thank you very much. Clearly, for the question, clearly the decisions made by medical health officers reflected the evidence on the ground, evidence of transmission. And again, as Dr. Henry has said, this is a profound challenge that everyone is facing in every jurisdiction about a virus that doesn't pay attention to our best wishes, but requires, in many cases, action. In this case, the decisions taken by public health were the right decisions based on public health and in the interests of everyone. And so they're absolutely, I believe, the right decisions to have made. En français, je dirais que ces décisions de la part de Dr. Henry ont été mises en force dès qu'elle a prononcé cela il y a une semaine. Il y aura des ordres écrits bientôt, mais ce qui est important de constater que c'est la force de ce qui s'est passé, c'est à